protection, they all ultimately can affect the development of the brain. So what does research have to say about practice? I'm not going to endorse a program by name, okay? Mainly because that's not helpful, because a lot of programs by name are implemented in very different ways all over the place. But here's what research has to say that's very important, regardless of where the money is going. We need to simplify things. All of this could be simplified with two dimensions here. What we need, young children need supportive relationships, stable, nurturing, supportive relationships, and positive learning experiences that are appropriate to their age. And that could be provided in lots of different places. It starts in the home. Family is still a major influence on children's development, but it also can be provided through a range of services with well-documented effectiveness factors. The quality of the staff, the ratios of adults to kids, the size of the groups, all of these things are proxy measures for the quality of the relationships and the nature of the learning experiences. And when we put resources into settings that address these two issues, we get good results. And when we put resources or don't put them into settings where there are not stable, predictable relationships, it's why staff turnover is such a problem in childcare. It's not just a management issue. It's a discontinuity of relationships issue. This activates kids' stress response systems. I'm not telling you that when staffing changes their childcare center, kids get damaged in their brain. I'm not telling you that at all. What I'm saying is it's not good for their development. Okay? Second is we need a balanced approach to emotional, social, cognitive, and language development if we want to produce success in school, in the workplace, and in the community. This is not about touchy-feely. This is not about having a bleeding heart. This is the way the brain works. This is how it works effectively. And not only in school or in preschool, but I think all of us, I mean, my favorite analogy to this would be to ask anybody in any workplace, anywhere, from the easiest to the toughest, when things aren't going well in the workplace and the workplace isn't producing, which do you usually need? Do you need everybody in the workplace to have 4 more IQ points? Or do you need a workplace where people can work together and basically not have their personal problems be interfering with what the workplace is trying to achieve? This is not touchy-feely. This is how competence is built. And finally, independent of broad-based issues around early care and education that are relevant for everybody, there clearly is a relatively small but tremendously important subgroup of the population of young children who are experiencing toxic stress, and they need highly specialized interventions as early as possible. And by definition, most kids experiencing toxic stress are in families that cannot advocate for them very well. They don't storm the State House. They don't help write legislation. These are the children most in jeopardy. These are the children most likely to sustain long-term consequences. These are the children most likely to cost society the most money later on. Jail is more expensive than any educational intervention anybody could think of. And these are the problems that will not be well served by a modestly trained, well-meaning person visiting you in your home once a week and asking how things are going and showing you some things you can do with your kid. That's where we get to the issue of matching our interventions to the magnitude of the problems we're asking people to address. This is the most underaddressed part of the early childhood world. These are the people who are disproportionately dropping out of programs, never getting to programs, and everyone pays a big price for that. Many of you are familiar with this slide that Jim Heckman has put together showing the inverse relationship between when we invest in human capital and what the return on investment is. It has a very simple message that the younger the children are, the higher the rate of return on investment in human capital for high-risk populations, just for high-risk populations. So job training programs for adults who can't read, which we have to do, okay, but that's the price we're paying for what we didn't do earlier. They cost more and they produce less favorable returns than remedial education for a 4th grader who can't read. It costs you less and you get a better outcome if you intervene in 4th grade. But that intervention in 4th grade is more expensive and gets a less good outcome than a good preschool experience, which doesn't get you as good an outcome as an intense intervention right after birth for a child in a highly toxic situation. And the reason for that is because of the hierarchical nature of the way the brain is built. Because what you ignore early on, you have to face and deal with for the rest of the kid's life. The kid has to deal with it, and society has to deal with it, because you can't go back and rewire. So this is all a matter of what kind of foundation we're working on. So I have just 2 slides to finish, and I want to leave you with some thoughts here. How do we advance an effective policy agenda? Because I think when all is said and done, the people in the policy arena have to have some simple decisions to make and can't be told. I mean, the answer, the summary slide is not we need comprehensive, family-centered, community-based, universally available services that are culturally competent in every community. Although one could make a good case for that, it's not a very helpful recommendation. And people kind of have to answer the question of where should we start and where are the relative priorities. Now this is my take on this, okay? Everything I said up until now is science. This is my take on that. Okay, so for starters, we have to build an appropriately skilled early childhood workforce. If we don't have people, whatever the programs are, if the people in the programs don't have the skills to match what we're asking them to do, there's no evidence-based services, there's no knowledge-driven agenda, and we're just kind of spinning our wheels. And there's no getting around this. And from my perspective, number one on the list always comes down to we've got to have people who are appropriately trained. We have to pay them enough so they won't go do something else. Otherwise, we're not going to get the results we need. The next is that we have to invest in evidence-based programs, and I put evidence-based in quotes because a lot of people just define evidence by cost-benefit analyses and outcomes. The problem is that there are a lot of areas where we don't have those kind of data yet, but we have a different kind of evidence. For example, if we don't have evidence about what the most effective intervention is for children who have abused or neglected at 6 months of age, the answer is not, let's do nothing until we have the evidence. Because the neuroscience is another form of evidence. It's rock-solid evidence. It says bad things are happening. And if the evidence on program evaluation we have is that these particular interventions are not really seem to be very effective, then the answer is, then damn it, we ought to try something else. Not we should do nothing until we come up with a good intervention. The healthcare system wouldn't tolerate that. When we have diseases that we can't effectively treat, we don't say, go home and come back when we have a treatment. We say we're going to use the best knowledge we have and we're going to keep working until we find something better. The last thing, and this is where North Carolina is one of the leaders in the country, certainly on public-private partnerships. Smart Start is a shining light in that area. This is a problem that's too important and too expensive to just be left to the government and to be caught up in kind of partisan squabbles. Okay, if there's any low-hanging fruit for bipartisanship in the country, investing in healthy development for all kids is a winner for bipartisanship. We've got to get over some ideological differences about individual responsibility in government and taxes and stuff, but bipartisanship and public-private sector partnerships are critical here because this is both a moral responsibility and it's a huge social and economic investment issue. You can cut it either way, but now you've all had the Kool-Aid. Once you know what we know about brain development, morally, how do you walk away? How do you say, oh, now that, when we didn't know that, you could say, well, it doesn't really matter. The kids don't know what's going on. They'll be okay. Now that we know this, how do you morally walk away from this? And now that you know this, how do you, from an economic investment point of view, walk away from this when you know you have a chance to head off some things that are going to cost you a lot of money later? So my last take-home is the need that we have to create the future of early childhood policy and practice. And this is where I'm starting to part company with a lot of my friends, is that the answer is not just to fully fund the programs of the Great Society. We need some new ideas. So we have to promote a culture of innovation and integration and continuous improvement in this area. We cannot just sit on the things we know. I am a huge fan. The contribution of the Abecedarian project is legendary. But the question should be, what beyond Abecedarian? Do we do? Not let's just bring it to scale. We have to deal with mental health problems in kids and in parents and in service providers, because no matter how much people read to you and talk to you, if you have mental health difficulties, you can't make it. And we have a huge and growing knowledge base here. We're not doing it, including depression in people who work in programs. And we have to do something about the economic circumstances in families. I mean, my dream is that at some point in my life, we will look back and say, could you believe in 2009, people used to think that if families were living under the poverty level and couldn't put food on the table and had to deal with that kind of stress and couldn't keep a roof over their heads, that we thought all we had to do to break that cycle was to give parents books and tell them to read to their kids? I mean, it's, we've got to do something about the economic circumstances that affects the stress that affects development. So here's your take-home message. Mess of equations on the left, mess of equations on the right. It says, then a miracle occurs. And the caption says, I think you should be more explicit here in step 2. This is the challenge for the field. It's not about early matters and let's see what happens later. It's not about, this or that. We have to be more explicit in step 2. What is it about the conditions that some children live in that produce bad outcomes? What is it about the policies and interventions that we're doing that will improve things? What's our theory of change? How do we test that? How do we get more explicit about step 2? We've got to get way beyond just the kind of getting on the soapbox and saying children are our future and let's invest in young kids. We've got to invest wisely. We've got to get smarter about this. And most important, we have to recognize that the science says that if we're doing very little, we are just perpetuating burdens and cycles that will go on forever. And now we all know that what this young generation also has to deal with later on top of everything else is they're going to have to figure out how to pay off an unbelievable amount of debt that's being accumulated, that is gaining an increasing part of the budget. So there really is no choice if the country has a future and if the state has a future than to get better and smarter about investing in early childhood from the very beginning. I'm sorry I ran a little bit over. I'll stop. Thanks.